This is Nan McKay, and this is a story of Milagros Zisa, who goes by Millie. She's a frontline emergency room registered nurse at a community hospital in New Jersey. Their hospital has been inundated with possible COVID-19 cases, and she has personally handled countless patients that have tested positive. She puts in many 12-hour shifts, and each shift consists of constantly disinfecting herself, equipment, and workspace. When she comes home at night, her husband sprays her with Lysol, her clothes are taken immediately into the basement in a box, and she runs straight into the shower without touching a knob or surface. So, Millie, first of all, thank you. Without people like you being willing to take the risks that you're taking, many more people would die.
Thank you for having me.
Now, I personally have never heard a firsthand account of someone working directly with coronavirus patients on the front line. So, describe to me a little bit about what your shifts are like from a reality point of view.
Sure. So I am a nurse in the emergency department at my hospital, and we usually do 12-hour shifts. Those have felt a lot longer lately, but it starts the same way every day now. We go in, we have our regular masks that we use everywhere else. And then we go to our charge nurse who hands us our respirator. So you get measured for a respirator when you have a job, when you're a medical professional. So I'm small and they have very few of those, but so they measure you for that. And we ask our charge nurse every morning, and she'll give you one mask, and you get to wear that for the duration of the shift. These are masks that prior to this, we would use as a one-time only, use when you went into a patient's room. So you would go in, you put the mask on, and you would throw it out. Now we're wearing these masks for 12 hours straight, barely taking them off to eat or drink when you get a chance to. So it's becoming a little more challenging to get through those 12 hours nowadays, especially, your face starts getting marks and kind of like hurting. You find yourself kind of moving your nose because it becomes a little numb after a few hours. But we start the day kind of the same way almost every day. In the ER, we don't get told who has COVID or not when they first come in, because a lot of the patients that come in don't even know if they have it. When they come in, they could come in complaining of back pain. And you sort of have to treat everyone now as if they were positive. So someone would say, oh, I have a lot of back pain, I'm here for back pain. And you're thinking, okay, well, we'll get you seen, we'll do an x-ray, or we'll give you medications, you'll be okay. But then you do their temperature, you take the temperature, and they have a fever, and they weren't even aware of it. So it's becoming a little more challenging. It's taking a little longer to treat these patients that, prior to this would kind of be even the fast track, oh, you broke your finger, but, your temperature's borderline. Have you had a fever? Have you been coughing? Is anyone at home sick? So it's taking a little longer. It's definitely been quite a change from what, I've experienced in the past few years in the ER. We do see or find ourselves treating a lot of the elderly population at my facility, because there's a lot of nursing homes around my hospital. So we've seen a lot of that population. It's pretty sad because we don't get to see family members with them the way we used to. And I know that that's a big part for patients to when they're sick, to feel better, to get better, having someone that they know, even when they have dementia, just having the daughter, granddaughter, son, whoever at the bedside is so important. And that aspect of care has been taken away, since the virus started. So that's been a little more difficult as well. We find ourselves in the room often because, of course, there's no one to help them in the room like usually a family member would. You have to go in and help them do things that normally someone else perhaps would have helped them do. So that's definitely been quite different. Just pretty much the putting on and taking off all the gowns that we have to put on, the shields. It's been quite it's been different. It's been very different.
Well, I've read about and heard on the TV about people who are elderly who have died and their family hasn't been there.
Mhm.
Have you
Yeah.
had that situation?
Yes. Unfortunately, like I said, because family members are no longer allowed in the hospital, um, these, patients are coming in sometimes from nursing homes, and they're just, I mean, they're really sick, and we know they're not going to make it. And usually, in these situations, we would have family come in and we would tell them, call whoever else you want to call and whoever else you need here to be at the bedside with them. Um, Now we're not granted that much time. So people come into the ER and we kind of just know if they're not going to do well, you sort of stay in the room with them and talk to them, and you try to give them the comfort that you can. It's very difficult. I am lucky enough to work in a place where we have had these like iPads and methods of communication to give family members a call and FaceTime them so they can at least see their loved ones. But it's not always the case. A lot of times we don't have the time in the ER, at least, to do that for every patient. So there have been a lot of people that have passed and unfortunately had no one at the bedside.
I bet they're so grateful to have you there.
I hope so. I hope I hope I can make us even a small difference, just by holding their hand, just by being there for them and talking to them. I feel like that's really important, especially when you're feeling so sick or when you're at the end of your life. Like it's truly amazing and I'm very grateful that I get to do this.
Well, it's wonderful that you're there doing it. I'd like to hear some more of your stories. Now, sometimes people think it's only the elderly people that are getting this, but that's really not true, is it?
No. So at the beginning of this, this is actually the time where we were really scared. I remember coming home after a shift one day and telling my husband, this is not like the flu, like something is wrong. We were getting young, 40, 30-year-old males with no medical history, healthy as can be, marathon runners, like they were in good shape, and they were coming in with a lot of shortness of breath. Like they couldn't catch their breath. And it was so scary to see them come in and just struggling for air. And it wasn't just one or two, the numbers started rising, but there was not like a typical patient. It wasn't just the elderly woman or the elderly man that had, high blood pressure, cholesterol, diabetes, like it was healthy people as well. So we have seen a lot of healthy 30s, 40-year-olds that are very sick that end up intubated. And I mean, I just read something from my hospital. We actually discharged a few of them recently, and that's really encouraging. But this was, 2-3 weeks, later. So when this started, it was very scary because you just didn't know what you could bring home. You didn't know if you were next. You didn't know if what you were taking, the precautions you were taking were enough, especially because at that time we were using our masks, but taking them off, in between. And now we just pretty much keep them on at all times, but it was very scary.
Are all of the young people getting better?
From my personal experience, from what I have seen, the younger people, even the ones that were intubated, have been extubated. I have not heard of anyone in my hospital that has been that young that didn't do very well. Unfortunately, we did have a young nurse, and she was in her early 50s. My coworker who passed last week, 2 weeks ago. She started working with us throughout, when this pandemic started. She's been there for years, but she said she knew that this would get her, and those words really crushed me to think about now, because she had really bad asthma, and she ended up in the ICU, and I went to visit her, and she just looked like a complete different person. And I couldn't believe this was my coworker that I, spend shifts with and, lunches with. And it was very hard to see someone, that you share and spend time with so sick. And she was intubated for a while. We thought that she was going to pull through, and she didn't. And that was really heartbreaking. I think that was probably one of the worst things that, has happened in our ER. And our our coworkers have been amazing. We've all been pretty close and sort of very supportive. And it's been very rough, dealing with that. But yeah, that's probably one of the youngest people that I know that passed from this in my hospital.
Well, and it brings it home, because you knew her, you saw her all the time, and she does what you do. And that is the scary part. Very
Exactly.
scary. I so appreciate what you're saying. One of your important contributions is that you were raised in Peru until age 10. And not only are you a nurse, but you also help translate and care for Hispanic patients who don't speak English. Tell me a little bit about that.
Yes. So, yes, I was born and raised in Peru. I came to the United States when I was 10. Um, and the population that we serve at my hospital is predominantly white. We don't have a lot of, I shouldn't say a lot, but we don't have as much, minorities as other hospitals or other places. But lately we have seen a lot of Hispanic patients, and they come in, and we do have phones that nurses, doctors can use to sort of translate. Unfortunately, in the ER, depending on the pace, if we're really busy and everything moves so fast, sometimes it's harder to go get the phone and find out what they want, especially during triage when a patient first comes in. You need to know why they're there. Are they there because they're having chest pain? Is it something like, is it their back pain? Is it their arm? And a lot of times they can't even communicate that. So I'm one of the few nurses in my ER that is Spanish speaking. So I have been asked to translate for a lot of these patients that come in. And I have noticed that a lot of this population requires a lot of education as well. So through this COVID pandemic, I have been there, sort of teaching them things. And it's very rewarding because I can understand my own parents, when they first came here, didn't speak any English. And my mom was a sick woman. She needed to go to the hospital quite often. And it was very scary. It was very scary for her to go and, explain to someone that she has allergies and she has asthma and this is how she's feeling. And scary to think that someone might not understand and they might give you something else or not treat you a certain way because you don't know what they have. So I feel like it's a privilege for me to be able to translate and help this population get the healthcare that they need, and do it in a short period of time and fast, because it's the ER. We don't have a lot of time, but it's very rewarding. And I've found that our population, our Hispanic population, has really grown in the last and since the pandemic started. So
Why did you decide to work in the ER?
So prior to the ER, I used to work on a med search, like a tele floor, and it was good. I learned a lot for a couple of years, but I wanted a challenge. I really enjoy the high paced, craziness of the ER. I enjoy, running around like a chicken without a head, like people say, and it's very. I learned a lot, and because I was in school as well, or I started school, I knew that it would be a great opportunity for me to, expand my knowledge, to see different cases, things that I couldn't see on a regular floor. So ever since I started, I've loved it, and I don't want to do anything else.
When you think back over the time that you've been a nurse, what would you say is your most heart-rending story that you have?
Ooh, oh my goodness, we have so many. I can think of a lot of great stories, but I guess the most recent one, because it stands out in my mind, because it just happened. It was a couple of weeks ago when we had this man come in. He was coming from a nursing home, and as they're putting him on the bed, they're saying, the paramedics are saying, he's short of breath, he's had a fever. So we're thinking, okay, he has COVID. He has not been tested, but we're assuming it is. So at that point, I'm putting on my gown and my mask, and my doctors know we're she wasn't around then. I don't know where she was, but I was going in there first to see the patient and kind of get them settled. And I noticed that he became very, very short of breath. Like he looked really different than from I saw him from the ambulance to the stretcher. And I said, there's been a change. At that point, I had someone call my doctor over, and we knew it was imminent. Like he was dying. And, we tried to make him as comfortable as he could. And I just remember putting the pillow behind his head, and he looked at me, and I had 2 pairs of gloves, a gown, my mask, my shield. And I held his hand, and he tried to say something to me through the mask, and I couldn't understand because he had the mask. And it felt weird because this is not the human connection that I'm used to. I'm used to holding and feeling, your skin, your hand. Now we're doing this through layers of plastic and clothing and, all the barriers that we have to put between us. But in a way, it felt so human as well. It was a beautiful moment. I was able to hold his hand, and I knew that he was going to die, and there was nobody around that he knew. It was me. It was me, my doctor, and I held his hand. I made him more comfortable, and I told him that it was okay for him to go, and that we were going to call his family and let him know that he was comfortable, and that because we knew he was going to pass, that he could go, that it was okay for him to go, because at that point, we weren't going to intubate him. It would have put him through torture. Like he was an elderly man that was sick. And there was a moment where he kind of like nodded and like he understood. And it was beautiful because I felt like we didn't try to do any heroic measures that we usually would do. I mean, intubating him and, chest compressions and these things that a lot of families probably don't get to see it and they don't really understand. But usually that's really, it's heart-wrenching to do that to some patients. And with him, he was able to go peacefully. I know he was having trouble breathing, but just giving him that mask, putting him, his head on a pillow and just making him feel comfortable was so rewarding, because it was sad because he had passed, but he had passed in such a peaceful way. And I really, I was very lucky to be able to do that for him.
He was very lucky to have you there.
Yeah.
When you say intubating, is that putting something down your throat?
So that's the tube that you put through the mouth down the throat to help them breathe. So that's when you put someone on what we call like life support. You have the machine that's breathing for the patient. So that's what a lot of our patients with COVID have been coming in and having to get intubated, because they can no longer breathe on their own. While you're intubated, you're sedated, and we do that for a lot of our patients. With this particular patient that I mentioned, he wasn't really a candidate. I mean, he was not going to make it.
Have you seen any children that are subject to having to have this done, or any of those?
So to be honest, my ER is split into 2 separate sections, I should say. They have a pediatric section, and then we have the adult section. I only work in the adult section, so I have not been in the pediatric section. I have heard that there have been positive cases of kids, and I think there was a baby, but I do not know that anyone got intubated. I'm not aware if they have.
That would be so hard, wouldn't it, to be in the children's area?
Oh. Yeah, no, I learned the hard way. When I started working in the ER, they did float me there once, but it was more because they needed an extra hand, not because they needed a nurse to take over patients. So I just went to help. But that day they had a 1-month-old baby whose baptism had been earlier that day, and the parents were exhausted. And I think the dad woke up in the middle of the night with him to feed him, and must have fallen asleep and rolled over him. And the baby came in, and I feel like it was PTSD after that, because I just remember the 2 little like white feet. And I give my coworkers so much credit for doing what they do with pediatric patients, because I'm not good with kids in that sense. I can revive an adult, I can help, but this was a 1-month-old baby. I have never experienced, I have never seen anything like it. And it stayed in my mind, for a very long time. I would close my eyes and all I would see is the little feet, and it was just horrible.
I worry so much today because things I'm reading are saying that child abuse is worse, getting worse, because often the abuser is in the home 24 hours a day. They've got a lot of other stress going on, and
Yes.
that's not good.
I mean, domestic violence rates. I've read the same things. We have not personally. I have not seen many patients come in to the ER with uh, those complaints. We have seen a lot of psychiatric patients, unfortunately, come in either having like breakdowns or needing to be hospitalized. But also a lot of relapses, substance abuse, people that have been sober for months that just started drinking again because they're home, they don't have a job. Now they're, things are starting to settle in, and it's hard for everybody, but they're, this population that we didn't even think about at first. And then as, the virus progressed, we were like, we're seeing them more. And unfortunately, that's what I've been seeing a lot of lately.
About a month ago, your hospital was struggling to find PPE. Are you still short on those supplies?
We're better, I believe. We have had a lot of help from the community, a lot of support. Um, we had a drive where people came by and dropped off, masks and gloves and whatever else they could, and we got a lot of stuff from that. But lately, I have felt that we have had more PPE or the same amount of PPE, but we're recycling it better. So our gowns are coming in more like promptly. Before we would kind of run out of them and had to wait a little bit before getting the next shipment. So now I think we're getting them more often. So I mean that we've been lucky with.
Well, that's good. Now you're graduating with a master's degree in 2 weeks. I think that's fabulous. You're just an amazing woman. And after all you've been through, your husband says that you still wake up every morning with the same passion and energy to save lives.
Yes. My husband's been amazing. He he's the reason why I'm so sane nowadays because we've been lucky enough that he's been working from home, but he's been my rock, my supporter, like my number one supporter. He's been amazing. And as you mentioned earlier, we do have sort of like a cycle every night when I come home from work, and he sprays my shoes, and I have a box that we have at the side of the door where I throw all my clothes, and then I run upstairs to the shower, and and then I can say hello. So it's been it's been quite a change, but he has been absolutely amazing, and it's because of him that I'm sane. He's been taking over a lot of the house responsibilities. Like I said, we just bought a home 3 months ago before this all started. So we were just trying to get used to the whole home ownership, and then this happened, and he's been just amazing. He's just been great.
And he's the one who nominated you to be a Hermosa modern day hero.
He did. He has been every day. He tells me how proud he is of me, and I mean, I look right back at him and I'm like, I'm so proud of you. I feel like I couldn't do this if it wasn't because of you. You give me that strength and the support, and he packs my lunch every day and makes my coffee every morning before I go to work. So he's been, my rock.
Is he there at home with you?
He is. He's actually on a call downstairs because he's been
Oh,
working.
I was hoping we might be able to just say hello to him and say thank you. Well, tell him that we appreciate what he did for you and what he continues to do for you, because it makes you able to do things that none of us can do. And we so appreciate everything that you have done. Thank you so, so much.
Thank you so much. I really appreciate it.